So cyclophosphamide, this is, we use this in ANCA vasculitis. We use it in a lot of our other vasculitides as well, and I'll go into some of those. Basically, the use of cyclophosphamide and prednisone transformed ANCA vasculitis from a uniformly fatal disease to a chronic disease. And this is huge. There's still a significant mortality rate, but we were able to, with the use of Cytoxan, this happened in the 50s, we were able to get people, about 93% of patients, into remission. But 50% of them had side effects. And when we first started using this drug, before we started learning about azathioprine or methotrexate or some of the other options we could use for long-term control, basically the plan was use this drug to get them into remission and then keep using this drug. And there was really no endpoint, and no one was really sure what to do after that. And is it safe to ever stop it? And we all knew the side effects were happening, but it was really between a rock and a hard place, right? So you're trying to control the disease, but you're using this toxic medication with known side effects. And when can you stop, or what do you look for? So initially this medication was used as a chemotherapeutic agent in cancers, but like I said, in the 50s we found that it was effective in rheumatic diseases. We use it in ANCA vasculitis. We also use it in polyarteritis nodosa, cryoglobulinemic vasculitis, Takayasu's. There's a lot of different vasculitides where this drug is used. Basically it's broken down into phosphoramide mustard. That's its active component, and it disrupts nucleic acid binding, so you have problems with DNA synthesis, and that's one of the ways that it works. So there are, like I said, you're always going to talk about vaccines, so there's major interactions with vaccines. You don't want to get a live vaccine while you're on this medicine. And then there's other medications you might be on because you were doing well up until this point where you needed to get induced with this toxic drug. So it can increase toxicity if you're using it with allopurinol, cyclosporin, Enbrel, which is a medication that we use as well in rheumatoid arthritis and other diseases. St. John's wort, some people take that. Again, I know if you guys were here for those herbal and other medication talks, we need to know what you're taking. St. John's wort is one that definitely affects how your enzymes process some of these other medications. People take it for anxiety, and they don't put that on their med list because it's a natural supplement, but it really can affect the dosing of what we're doing. So it just, again, trying to reiterate the importance of making sure we're really aware of all the different things you're putting in your body, so we can try to make sure that what we're using is going to be effective. So as I mentioned, the higher dose results in more toxicities, and before we really just had to use it for many, many years before we had any other agents to try to control the disease. But now, luckily, we basically, if we're going to use this medication, are treating for 3 to 6 months maximum, and then we're trying to switch to an alternative maintenance regimen. So that's really good news, because a lot of these side effects that I'm going to mention here are really side effects that are much more prominent when you're on this drug for this extended period of time. So it can suppress your bone marrow. We are watching your blood counts regularly, and we basically adjust the dose based on your white blood cell counts. It can affect it can be toxic to your gonads, so ovaries and testes. So in young women, if we're going to have to use this medication, if we have the option, we will talk to them about egg banking beforehand to try to preserve their fertility that way. And then also you can get testicular injury after 7 to 9 grams of Cytoxan. Like you can get amenorrhea, premature ovarian failure. So these are things that we definitely want to talk about with our patients, especially depending on their age. Infections, as I mentioned, we try to use prophylaxis when needed, like Bactrim prophylaxis to prevent against certain types of pneumonia. The Hpv vaccine is something that we would definitely want to give to our patients before starting this medication, because you have increased risks of reactivation. Another toxic side effect from cyclophosphamide is hemorrhagic cystitis, or bladder cancer. This is also due to a breakdown product of that drug, and the risk is highest when you're on doses of 50 to 100 grams. So one of the ways that we try to protect against this is by using a lot of hydration. If you're getting it through the IV, we'll give you tons of saline beforehand. After, you'll know that you're getting it. And if you are getting the oral form, we're going to really be on your case about drinking plenty of fluids to try to flush this out of your bladder to try to help prevent this toxicity. So again, this is 50 to 100 grams. The good news is, when we just recently did a study in 2015 looking at over like 1,000 patients to see how much Cytoxan are we really giving to our patients these days, the median dose was 9 grams. So this is a lot less than the doses that were initially causing a lot of these problems. I'm not saying that these problems aren't things we need to continue to monitor and look out for, but luckily, because, like I said, we're moving quicker to replacing them with these other medications, we're going to have less of this moving forward.